A cutaneous T-cell lymphoma skin symptoms treatment journey. Understanding THERAKOS Photopheresis and CTCL skin symptoms.
Uvadex, methoxylin sterile solution, should only be used by doctors who have special skills in the diagnosis and treatment of CTCL and who have received special training and have experience in the THERAKOS Photopheresis system. Do not undergo the THERAKOS Photopheresis system procedure if you have a condition that makes you unable to tolerate loss of blood volume, you are allergic or hypersensitive to 8-methoxysorolin, methoxylin, or sorolin compounds. Your doctor has diagnosed you with a blood clotting or bleeding problem that can lead to either a blood clot or excessive bleeding. You have had your spleen removed. Do not use Uvadex if you are allergic to methoxylin, any product similar or related to it, such as sorolin, or any of the other ingredients in Uvadex. You have a history of a light-sensitive condition or disease. You have had an eye lens removed. Use of Uvadex in this condition can increase the risk of retinal damage.
Hi, I've been treated for the skin symptoms of cutaneous T-cell lymphoma, or CTCL, for quite a while now. I've had some improvement over time, but my skin symptoms have gotten worse again, even though I'm taking the medicine that my doctor gave me. Today, I'm going to see my doctor about a different kind of treatment called photopheresis, which she said may help manage my CTCL skin symptoms from the inside out.
Hi, John. It's nice to see you again. How are you feeling?
Hi, Dr. Morris. I'm not feeling great. My skin symptoms have worsened again. But I'm excited to learn about a different way to potentially treat my CTCL skin symptoms. Hopefully, I'll be able to get some relief. Can you explain to me again what photopheresis is?
Sure. Photopheresis was developed by a physician. It's an immunotherapy that harnesses the power of your own immune system to help treat your CTCL skin symptoms.
But how would using my immune system help my skin symptoms?
CTCL is a cancer of white blood cells, which are part of your immune system. Photopheresis helps manage the skin symptoms of CTCL by treating a portion of your white blood cells. Photopheresis can regulate your immune system to work on your CTCL skin symptoms from the inside out.
Oh, interesting. Are there any side effects I should know about?
Some of the possible side effects of photopheresis are low blood pressure, which can make you feel dizzy or weak, an infection and/or pain at the injection site, a fever of 100 to 102 degrees Fahrenheit within 6 to 8 hours after treatment. Redness of the skin may also occur with the fever, and a decrease in red blood cell levels, which may cause you to feel tired. This can occur if you get treatment too often. Be sure to tell me if you have any side effect.
Okay, I will. So how will I receive this treatment? What is the process like?
Photopheresis is an outpatient procedure that is FDA approved and has been in use for many years. The treatment is generally administered in the hospital's apheresis center by trained practitioners. During treatment, you will be connected to a specialized device through an IV. By working with your immune system, specifically your white blood cells, photopheresis can help your body to manage the skin symptoms of CTCL. I will refer you to the treatment center medical director for an intake evaluation.
Oh, okay. What's the treatment center like?
When you go in for your first appointment, you may want to request a tour of the center. This will help you get more familiar with the center and the procedure before your first treatment.
That's a good idea. How often will I need to go in for treatment?
Your procedure will be given on 2 consecutive days every 4 weeks. Treatment time can vary. In your case, I would expect the treatment to take around 2 hours each visit.
Oh, that's manageable for me. And how long are people typically on this treatment for?
Most people have treatments for a minimum of 6 months. Your treatment schedule may change due to unique medical needs and conditions, as well as your response to treatment.
Okay, good to know. I'm looking forward to getting started.
Great. Let me get your referral for you.
Thanks, Dr. Morris.
Warnings. You may be at greater risk of sun sensitivity with Uvadex. Tell your doctor if you are taking other medications that cause sensitivity to sunlight, such as anthralin, coal tar, or coal tar derivatives, griseofulvin, phenothiazines, nalidixic acid, halogenated salicylanolides, bacteriostatic soaps, sulfonamides, tetracyclines, thiazides, and certain organic staining dyes, such as methylene blue, toluidine blue, rose bengal, and methyl orange. If you are pregnant or plan to become pregnant, tell your doctor. Methoxylin can harm your unborn baby. Tell your doctor right away if you become pregnant during your Uvidex treatment. If you are breastfeeding or plan to breastfeed, tell your doctor. It is not known if methoxylin passes into your breast milk. Okay, John, now that we've determined you to be an appropriate patient for photopheresis, let's go over the procedure and what you can expect.
That sounds great.
Now, there are a few things you need to do to help the treatment process go as smoothly as possible.
Okay.
Starting 2 days before your treatment, you should drink plenty of fluids, such as water or juice. It's also good to avoid caffeine and alcohol before treatment, as both can reduce fluid in the body.
That makes sense.
You should also avoid eating fatty foods like pizza or French fries right before your treatment.
Ah, I guess I'll have to skip that double cheeseburger then.
Yes, probably. When you first arrive for your appointment, you'll check in, and then you'll be taken to a place where you can get settled in.
Would it be possible to take a tour today so I know where that is?
Of course. I'll have one of our nurses show you around after we're done here.
Thank you.
No problem. We want to make sure you're as comfortable as possible. So when you arrive for your appointment, remember the process will last about 2 hours, so you may want to use the bathroom before getting started.
Right. Okay.
Also, you may want to bring something to pass the time while you're there, like a book or a laptop, or you can take a nap.
Oh, that's a good idea. Do I need to bring someone with me to drive me home afterwards?
Great question. You can choose to bring someone with you, but it's not required.
Okay, good to know.
Yes, and don't hesitate to ask if you need anything. Your healthcare team is here to help with whatever you need.
Thanks. I can't wait to meet the rest of them.
I'll introduce you to them shortly. But first, let's go over the procedure.
Sounds good.
For photopheresis, there are 2 methods that can be used. There's a single needle technique, which means a needle will be inserted into one of your arms. The single needle technique allows you to have a free hand. There's also a double needle technique, in which a needle is inserted into each arm. This usually shortens the treatment time. We can work together to decide what's right for you.
Oh, interesting. Will it hurt?
Some people have little or no discomfort. However, you may feel pain where the IV line is placed during treatment. If you're nervous, we can talk about ways to possibly lessen the discomfort.
That's good to know.
Yes. So after the needle is inserted, blood is removed and moved into what is called a centrifuge. This is where the red blood cells, white blood cells, and plasma get separated. Red blood cells and plasma are returned to your body, and the white blood cells are collected in a treatment bag where the medicine Uvidex is injected. Uvidex is a photoactivating agent that targets the DNA inside the white blood cells. The cells are then treated with UVA light, which activates the Uvidex. These treated white blood cells are then returned to your body.
Wow. So how does this help with the skin symptoms?
CTCL is a cancer of white blood cells. Photopheresis works on your skin symptoms from the inside out by treating cells in your blood. While progress has been made in understanding how photopheresis works at a cellular level since it was first approved in 1987, the exact way it works is not fully understood. Once your treated cells are returned to your body, they can help regulate your own immune system. Although there is currently no cure, in this way, working with your immune system may help relieve your skin symptoms.
Ah, I see. Will I feel any different right after the treatment?
Some people can feel tired or weak after their treatment. You should let your healthcare team know how you're feeling during and after each treatment.
Okay, I will.
It's also important to know that Uvidex makes you more sensitive to sunlight for about 24 hours after your treatment. You should avoid direct or indirect sunlight, wear sunscreen, and UVA protective wraparound sunglasses for the 24 hours following your treatment.
Okay, that's good to know.
Yes. All right, I think we've covered your questions. Would you like to take that tour now?
Sure.
Excellent. I'll have Nurse Jessie show you around. Warnings continued. After Uvidex is given, exposure to sunlight and/or ultraviolet radiation may result in premature aging of your skin. Let your doctor know if you currently have skin cancer or if you had skin cancer in the past. If you are given too much Uvadex, you may get serious burns from UVA or sunlight, even through window glass. Avoid exposure to sunlight during the 24 hours after treatment. Exposure to UVA light when Uvadex is used can cause cataract formation if proper eye protection is not used. You must wear UVA light-absorbing wraparound sunglasses for the 24 hours after treatment with Uvadex when you are exposed to direct or indirect sunlight, whether you are outdoors or exposed through a window.
Hey, Jesse. Hi, I'm Megan.
Hi, Megan. I'm John.
Nice to meet you, John.
Nice to meet you, too. I'm just having a look around right now.
Oh, is this your first time here?
Yes, it is.
Ah, I remember my first visit.
Have you been coming here for a while?
A little while.
How do you like it?
Everyone here is so friendly and welcoming. They always ask how I'm doing and make sure I'm as comfortable as possible.
That's great.
Yeah, coming here each month has allowed me to really connect with my healthcare team. I always look forward to seeing them.
Wow, that's really nice to hear. If you don't mind me asking, has the treatment been working for you?
It took a little while before I noticed improvement. In fact, my doctor told me most people may not see a response right away.
Why is that?
Because photopheresis is a type of immunotherapy that works with your body's immune system to fight the cancer cells. It can take a little while for your immune system to have a response. So it's important to be patient and remember that everyone is different and results may vary.
Oh, that's good to know. I'm definitely willing to try something different.
Great. Be sure to always talk to your doctor and the rest of your healthcare team if you have any questions or concerns, and follow your prescribed treatment schedule, even if you don't see any improvement right away.
Thanks, Megan. You helped calm my nerves a little bit. It was nice meeting you.
Nice meeting you too, John. See you later.
Warnings continued. If you are being treated for graft versus host disease, GVHD, consult your physician for information regarding blood clots involving the lung and other parts of the body which have been reported in these patients. The use of Uvadex for the treatment of GVHD is not approved by the FDA. Safety of Uvadex in children has not been shown. Side effects of Uvadex. Side effects of Uvadex used with the THERAKOS Photopheresis system are mainly related to low blood pressure.
Oh, hey, John. How are you doing?
Hi, Megan. I'm doing well. I just had my first treatment, actually.
That's great. How do you feel?
Pretty good. The nurse mentioned that I may feel tired or weak after the treatment.
Yeah, that's true.
Hey, thanks again for introducing yourself last time and telling me about your experience. I was feeling a little nervous, but talking to you has made me more comfortable.
No problem. I know photopheresis is very different than the other treatments you've received in the past, and it's certainly okay to be nervous. I was at first, but everyone I've met throughout this process has been so kind and supportive. And if you have any questions, don't be afraid to talk to your healthcare team about how you're feeling.
Thanks, Megan. I will.
Important safety information. Uvadex, methoxylin sterile solution, should only be used by doctors who have special skills in the diagnosis and treatment of CTCL and who have received special training and have experience in the THERAKOS photopheresis system. Do not undergo the THERAKOS photopheresis system procedure if you have a condition that makes you unable to tolerate loss of blood volume, you are allergic or hypersensitive to 8-methoxysorolin, methoxylin, or sorolin compounds. Your doctor has diagnosed you with a blood clotting or bleeding problem that can lead to either a blood clot or excessive bleeding. You have had your spleen removed. Do not use Uvadex if you are allergic to methoxylin, any product similar or related to it, such as sorolin, or any of the other ingredients in Uvadex. You have a history of a light-sensitive condition or disease. You have had an eye lens removed. Use of Uvadex in this condition can increase the risk of retinal damage. Warnings. You may be at greater risk of sun sensitivity with Uvadex. Tell your doctor if you are taking other medications that cause sensitivity to sunlight, such as anthralin, coal tar, or coal tar derivatives, griseofulvin, phenothiazines, nalidixic acid, halogenated salicylanolides, bacteriostatic soaps, sulfonamides, tetracyclines, thiazides, and certain organic staining dyes, such as methylene blue, toluidine blue, rose bengal, and methyl orange. If you are pregnant or plan to become pregnant, tell your doctor. Methoxylin can harm your unborn baby. Tell your doctor right away if you become pregnant during your Uvidex treatment. If you are breastfeeding or plan to breastfeed, tell your doctor. It is not known if methoxylin passes into your breast milk. After Uvidex is given, exposure to sunlight and/or ultraviolet radiation may result in premature aging of your skin. Let your doctor know if you currently have skin cancer or if you had skin cancer in the past. If you are given too much Uvidex, you may get serious burns from UVA or sunlight, even through window glass. Avoid exposure to sunlight during the 24 hours after treatment. Exposure to UVA light when Uvidex is used can cause cataract formation if proper eye protection is not used. You must wear UVA light-absorbing wraparound sunglasses for the 24 hours after treatment with Uvidex when you are exposed to direct or indirect sunlight, whether you are outdoors or exposed through a window. If you are being treated for graft versus host disease, GVHD, consult your physician for information regarding blood clots involving the lung and other parts of the body which have been reported in these patients. The use of Uvidex for the treatment of GVHD is not approved by the FDA. Safety of Uvidex in children has not been shown. Side effects of Uvidex. Side effects of Uvidex used with the THERAKOS Photopheresis system are mainly related to low blood pressure. For the THERAKOS Photopheresis system procedure. What is the THERAKOS Photopheresis system procedure? The THERAKOS Photopheresis system procedure is a medical procedure in which blood from a patient is collected into a specialized machine that separates the white blood cells from the other blood components. The other blood components are returned to the patient, and white blood cells are then treated with Uvidex, which makes them sensitive to ultraviolet light. The treated white blood cells are exposed to UVA irradiation inside the machine and then returned to the patient. This medical procedure is used to treat skin problems associated with CTCL in patients who have not been responsive to other forms of treatment given by their doctor. Do not undergo the THERAKOS Photopheresis system procedure if you have a condition that makes you unable to tolerate loss of blood volume, you are allergic or hypersensitive to 8-methoxysorolin, methoxylin, or sorolin compounds. Your doctor has diagnosed you with a blood clotting or bleeding problem that can lead to either a blood clot or excessive bleeding. You have had your spleen removed. Warnings for the THERAKOS Photopheresis system procedure. Treatments with THERAKOS Photopheresis system should always be performed where standard medical emergency equipment is available. THERAKOS Photopheresis system procedure should not be performed on the same day as procedures that can cause fluid changes, such as renal dialysis. Side effects of the THERAKOS Photopheresis system procedure. Low blood pressure can occur with the THERAKOS Photopheresis system procedure. You may get an infection and/or feel pain at the site of injection. Fevers of 100 to 102 degrees Fahrenheit, 37.7 to 38.9 degrees Celsius, have been seen in some patients within 6 to 8 hours after treatment. Redness of the skin may also occur with the fever. A decrease in red blood cells can occur if the THERAKOS Photopheresis system procedure is given too frequently. Low levels of red blood cells may cause you to feel tired. These are not all of the possible side effects of the THERAKOS Photopheresis system procedure. Tell your doctor about any side effects that bother you or that do not go away. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to the FDA. Call 1-800-FDA-1088 or visit www.fda.gov/medwatch. You may also report side effects by calling THERAKOS at 1-833-223-4327. Please see the full prescribing information, including the boxed warning for Uvidex,